Hi, I'm Dr. Salman. I'm the medical director of O'Reilly Cosmetic Clinic. What makes us special? We give you true advice. So if you come to us, we're going to advise you accordingly. And please, if we tell you don't do the surgery, we do mean it. Don't do the surgery. So that's what differentiates us from the rest. We give you true advice. But the other thing about it is we're not one-trick pony. So we do quite a bit of surgery, different types. We provide a full range of solutions from a cosmetic surgical perspective. And we don't do one trick and we have to push you toward it. So we can give you the options and you can look at it and decide from that perspective what suits you best. One of the nice things about us here is if we tell you to go home, then please do go home. Don't do surgery. So it's fundamentally important to have a consultation in person. And there is a multi-dimensional to that. One of them is to get to know your surgeon and you're quite comfortable with them. There's no point you having a consultation with my secretary or my coordinator. You need to talk to me because we need to build a relation that you trust me that I can do your surgery. The other part of the consultation, which is fundamentally important, is medical examination, where we examine you to see what your tissue is like, what your skin quality is like, how much tissue cover we have, and what is the best option to achieve the results you desire. One of the nice things about you coming to a consultation, please bring pictures of what you want to look like and certainly what you don't want to look like. And then we can discuss it because sometimes what you're trying to achieve is either not achievable or in a lot of cases, we can achieve a little bit better. For example, somebody comes in and they're requesting an abdominoplasty to make them look better in clothes. And when you examine them, you can say, look, I can make you look great even in a bikini. So expectation needs to be managed, but this is our job to tell you what you should expect and what is achievable. And really, we don't lead you down the garden path. We absolutely clear about what's achievable. So one of the questions I get asked often is, what's liposuction? Well, liposuction, you use a liposuction cannula to remove fat from unwanted areas, and sometimes move it to other areas which are called fat grafting. But generally speaking, liposuction is a removal of fat to give you a new proportion, to change the proportions of your body. For example, some people are born with a little bit of belly. No matter how thin they are, they still have this little bit disproportion to the rest of them, or saddlebags around the hips, or a little bit of a chin. So what liposuction does is change that proportion. We can remove fat from that area to make the proportion different. And that's what liposuction does. Now, this is completely different in cases of people who have quite a bit of fat, but the skin quality is not great, or the skin has been stretched, or they've lost a lot of fat after a massive weight loss. These things are different in the sense that we need to do something to address the skin issue, because liposuction doesn't address the skin issue. So selection criteria for somebody who's a good candidate for liposuction is to have a reasonably realistic expectation that they have a disproportionate area to the rest of them, and they have a good tone and quality of skin. And of course, they're fit for surgery. So all these indications need to be considered during consultation to decide whether you're going to get good outcome or not. On the other hand, you have what we do, a skin resection, or for example, in the case of an abdomen, a tummy tuck. Now, tummy tuck in my book should not be performed in somebody who hasn't finished her family. The reason for that is because we're going to take all the laxity of the skin and that leave you with very little elasticity to allow it to stretch in the future. So if you get pregnant, you will undo the results badly. That is fundamentally important. Now, in some cases, in somebody who had massive weight loss and they still haven't finished their family, in that case it's not a really, it's more like an apronectomy or a modified abdominoplasty, where in that case having children in the future is still be possible, but the results probably going to be a little bit undone. You can come to us and we discuss our option regarding liposuction, because a lot of people ask me, when should I get it? Do I need to lose weight? Do I not need to lose weight? It really depends on what we're trying to achieve. Doing liposuction, we change proportions, so whether you lose weight or gain weight after that is irrelevant, and the fat doesn't come back in that specific area. Now, if you go on and put 2 stone of weight, of course you're going to have a little bit more fat everywhere, but the new proportion or new ratio of your dimension of your body will persist as we left it after lipo. Well, any area that has fat can be treated with liposuction as long as, one, it's safe, second is realistic expectation, and third, the quality of skin allows us to do that, because sometimes you get people, for example, with fat in their upper arms. And if the skin quality is not great, doing liposuction there is not a good idea, because what you'll end up with is quite a bit of lax skin. So an arm lift might be more appropriate. Same with somebody who had a C-section or had a little bit of abdominal fat with an overhang, and the skin quality is not great. Doing liposuction might make it worse, especially in nude. In clothes might make it a little bit better, but this is the thing that needs to be discussed in consultation. That's why consultation is fundamentally important. Another thing about lipo, because there's a lot on the market of, oh, I can get 360 degree or high definition or Vaser or this or that or laser lipo. Liposuction is liposuction. How you do it depends on what you're trying to achieve and what's available in that specific clinic. In Aurelia, we have 3 different modalities. Liposuction, we use it for different reasons. Vaser liposuction is a fantastic machine. It's a brand, but it has ultrasound assisted liposuction. It's quite cool, but it's not the only machine that can do lipo. And of course, with the Vaser, you can do 3D, you can do 360. 360 is doing a circumferential liposuction. So these are all names people try to sell you things with, but in reality, you need to come here, we need to pinch you, and we need to tell you how we're gonna achieve the results that you need. In the old days where liposuction would be mainly reserved for people who want to reduce area dramatically, but now we have a lot of young girls who are quite fit, who work a lot, and they want a high definition lipo to give them a more athletic physique, especially of the abdomen. That's a high definition liposuction. Of course, can be done with Vaser or without Vaser, but this is just different names for different procedure. So come to us with pictures, we discuss your needs, and we will achieve the results you want. Don't fall for names. It means nothing. The ability of your surgeon is what matters. When you come for consultation, let us show you our results. Liposuction is quite a short recovery. Of course, the final results can take up to 3 months to materialize, but you'll be certainly presentable on a beach, in a bikini, by about 6 weeks. The first couple of weeks, you will see bruising, the skin will be hard and woody, you might have a little bit of unevenness, but that'll settle in time. You need to wear a compression garment, but the compression garment time varies from 3 weeks minimum to up to 6 weeks sometimes. The most important thing about lipo is that you don't stay in bed. So we want you back out and about, and if it's done properly and it's not too traumatic, you can have your surgery on a Friday, and if you're an office job, you'd expect to be at the office on Monday. It feels a bit lactic acidy, so when you move in, it feels a bit like you haven't done a long workout and you did a 5-hour workout. A couple of days after that, you feel a little bit sort of achy. But simple painkillers will deal with that. Certainly, if you're planning liposuction on a holiday, give yourself at least 6 weeks. One thing about liposuction in the right facility is quite a simple procedure if you know what you're doing, but and the recovery would be quite quick. You need to discuss your needs with your surgeon, and that what your surgeon can achieve and what you're looking for match, and that's really fundamental. So in our area, if we promise you something, we usually try to overachieve it, but realistically, what we tell you we'll achieve, we certainly will. That's where the examination is fundamental. We need to look at a couple of things. One, the elasticity and excess of skin that you have and the quality of the skin that you have. Usually people after having babies, the skin is stretched or stretch marks, the elasticity of it is not great, and there's quite a bit of it. And the second thing is we need to look at the muscle tone, because you get after pregnancy, especially ladies with very narrow hips, the baby sits high, so the top part of the abdomen is quite stretched, and you have a dehiscence of the recti, which is separation of the muscle, and that need to be repaired. So an abdominoplasty is not simply just taking the skin away. You need to repair the muscle to make it quite flat. You need to take the excess skin to make it reasonably tight, and then most of the time we need to reposition, well, all the time we reposition the belly button, so we recreate a more aesthetically pleasing umbilicus or belly button. So these are the three things. Now, sometimes, very rarely, we combine it with lipo. It depends really on you and what is needed, because if you do a very aggressive abdominoplasty, it's not a wise thing to do a lipo at the same time. So come to consultation, have your discussion, and then we take it from there.